Are you trying to conceive, or did you recently find out that you're pregnant? If so, I need you to tune in to find out the top 4 myths of pregnancy that need to be debunked. My name is Dr. Brooke Kolisiak. I am a pelvic physical therapist who is passionate about helping women optimize their body for their pregnancy, labor and delivery, and beyond. I firmly believe that women deserve practical, helpful information to help them navigate those murky waters of pregnancy. Unfortunately, most women, when they find out they're pregnant, their OBGYN gives them a packet of information to read through, and they're left to wade through the murky waters of the internet to try and get their questions answered and to see what's best for them. So in this video, I'm going to be going through 4 of the most common pregnancy myths that we see here at our practice, and I'm going to be debunking them all for you. There is so much misinformation out there that keeps women from having healthy, happy, comfortable pregnancies and deliveries. Here are some of the worst. Myth number 1, pain during pregnancy is inevitable. This is simply false. Yes, many women will experience pain, back pain being one of the most common things that women will experience during pregnancy. But just because it's common does not mean that it is normal. So the body is going through so many changes during pregnancy that we're going to see changes in posture, how your muscles are working, what your alignment looks like, your flexibility, your strength, just changes across the board. But just because we experience changes does not mean that that is going to cause pain. There are things you can do to both prevent pain from happening and to help treat it when it is happening. Some of the most common things that women do to help optimize their body for pregnancy, to avoid pain or to treat pain when they are experiencing it during their pregnancy, is to work or partner with a pelvic physical therapist, to partner with a prenatal chiropractor, to work with a massage therapist, to work with someone, again, maybe a pelvic physical therapist or a prenatal fitness specialist to optimize their fitness routine. Don't accept that pain is an inevitable part of your pregnancy. It is not. There are things that you can do to help if you're experiencing pain, and this can make your pregnancy so much more comfortable and make your body so much more resilient and ready for labor and delivery. Myth number 2 that is totally false during pregnancy is I should be doing lots of Kegels right now to get my pelvic floor ready for delivery. Not the case. Your pelvic floor does not push your baby out. Your uterus pushes your baby out. The contractions of the uterus do the work. Your pelvic floor actually needs to be able to relax, let go, and stretch. So although we want a nice, strong, supportive, supple, flexible pelvic floor, we don't want to be doing hundreds of Kegels right now, or worse yet, holding tense in the pelvic floor all the time. This is a time to look and see how flexible your pelvic floor is and how much give it is, and can it stretch and bulge out. That's why partnering with a pelvic physical therapist, especially towards the end of the 2nd trimester, early 3rd trimester, can be super helpful to assess if you're able to create a proper push and let those pelvic floor muscles elongate and stretch. So instead of thinking about doing Kegels during pregnancy, we want to think about promoting healthy flexibility and mobility in the pelvic floor, hips, and beyond. Myth number 3 during pregnancy, if you deliver vaginally, you're going to tear. This one's false. Yes, perineal tearing is common, and it most commonly happens right at the base of the vagina here, okay? So if this is the vaginal opening, at the base is the most common place that we get tearing to occur. But again, just because something's common, it doesn't mean it's normal. There are things you can do ahead of time and during the delivery to help prevent tearing. And this is, again, where partnering with a pelvic physical therapist can be very helpful. But ahead of time, learning how to do perineal massage and making sure that you can create a proper push and let your pelvic floor relax and stretch can really go a long way to help prevent perineal tearing from happening. And during the act of delivery, if it is possible, it can be very helpful to support the perineum with a warm compress as the baby's crowning to help promote that tissue to be a little bit more supple and flexible. So there are many things that one can do to help prevent tearing. It is not inevitable. Pregnancy myth number 4 that we are going to dispel today. Pelvic health issues are inevitable after having a baby. Not so. So what's a pelvic health issue? Bladder leakage, pelvic pain, pain with sex, pelvic heaviness or pressure. These issues can be common or more common after having a baby, but they are not inevitable. We should be seeing a theme now of common, not normal. So if you are experiencing anything like these symptoms, pain with sex, pelvic pain, bladder leakage, pelvic heaviness or pressure, know that you are not alone and there are things you can do to help get rid of these symptoms. So if you have a healthcare provider who says when you tell them that you're dealing with bladder leakage, oh yeah, you had a baby, that's totally normal now. When it gets bad enough, give me a call and we can do surgery. Or maybe you tell your healthcare provider that you're having pain with sex and they say, yeah, that's normal after having a baby. I don't see anything wrong. All you can do is maybe drink wine and try and relax. These are not good medical advice options. So you need to find other care if that's the type of advice that you are getting. And know that partnering with a pelvic physical therapist to assess what is going on with your pelvic floor, with your abdominals, with your core muscles, how they're all working together to support you and your posture and how you move. We assess all of that in that early postpartum period to make sure that everything is healing well postpartum. And if you are dealing with certain pelvic issues, you can address them early so that they can heal faster. It goes so much faster when we can work with you in that early postpartum period to make changes versus letting things go on for months, getting worse and worse. And then we have to undo a lot of things that have been done that can be problematic over those months of developing some bad habits. So we highly, highly recommend partnering with a pelvic physical therapist, both during the pregnancy to optimize your body for a happy, healthy pregnancy and labor and delivery, as well as coming back and working with a pelvic physical therapist early postpartum to assess your pelvic floor and core to make sure everything is healing well. So hopefully I have dispelled the top 4 myths of pregnancy for you, and you're feeling more optimistic in moving forward with your healthy, happy pregnancy and partnering with a pelvic physical therapist to optimize your body for your best pregnancy, labor and delivery, and postpartum recovery. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.